So you have an ankle sprain and you're wondering whether you should go to the ER or you should deal with this yourself at home. Now, today I want you to join me as I tackle the challenge of healing an ankle sprain at home using a very quick method to relieve this. Now, remember that over 2 million people have a sprained ankle in the United States alone every single year. That is about 7 ER visits every single year for ankle sprain. So on today's video, I want you to join me as we move through the simple R.I.C.E method and other methods that you and I can use to treat ankle sprains at home so that we can save ourselves time and money, and also when we should go to the ER to be seen. Now, the first thing you want to do based on clinical evidence is to protect the ankle from further injury. You want to make sure that you use things like functional bracing over rigid immobilization to protect the ankle for further injury. And once you are able to find a way to protect your ankle from further injury, the next thing you want to do is to apply the R.I.C.E method. The first one is to rest the ankle, limit activities that can cause pain and discomfort, modify activities in the early stages by trying to bear weight on the ankle as much as you can tolerate the pain. Now, once you are doing that, the second thing you want to do in the first 48 to 72 hours is to apply ice on it. Don't put ice directly on the skin. That's not good. It's going to burn your skin. So you want to do an ice pack to the area of the injury about 15 to 20 minutes every 2 to 3 hours for the first 72 hours to reduce the pain and the swelling. Now, once you've done that, then you want to go to the next one, which is the C, compression. What does it mean? Use an elastic bandage or a compression wrap to help reduce the swelling and ensure that the wrap is snug but not too tight to avoid cutting off circulation. That's very, very important. And other than that, the next thing you want to do is to elevate the ankle. Elevate the ankle above the level of your heart as much as possible when you are sitting down or laying down. And this you can do especially in the first 48 to 72 hours. And again, the rationale is to prevent a lot of swelling. Once you've done that, then you come to pain management, because when you break your ankle, it's very painful. So you want to, and when you twist your ankle and you have a sprain, it's very painful. So you want to control the pain as much as you can. Now, what you can do has been effective is using NSAIDs. Okay, that is ibuprofen, Advil, Aleve, sometimes acetaminophen. Taking them during the first few days can reduce the swelling and the pain because they are anti-inflammatory, so they reduce the inflammation as well. Now, make sure you take this medication with food, not an empty stomach, because it can irritate your GI tract and cause gastritis and ulcers. But if you have a kidney problem, do not take any NSAIDs. Instead, take acetaminophen if you have kidney problems for pain control. Now, once you've done that, this is the two areas that people miss, and therefore it prolongs their pain for a long time. It is early, apart from pain control, is early mobilization. Early mobilization. What I mean by that is gently start some range of motion of your ankle as soon as the pain allows it. Okay, and you can do things like begin to when you're sitting down, do like range of motions, and do this as long as you can, and the pain you can tolerate the pain. This is going to help you to increase the speed of recovery and also reduction of pain. And this is very important. This is an area people miss, and therefore they have pain for a long time. And the last one is rehabilitation. Rehabilitation is so important because once the acute phase is gone, you are not having severe pain, then a comprehensive rehabilitation programs like stretching, strengthening, or things like initiating things that can restore the function and also prevent future injuries are very important. Stretching exercises are good. Strengthening exercises are also good. These are good in order to what to prevent further injury of the ankle. So these last two pieces are so important for any ankle sprain. So in a nutshell, when you have an ankle sprain that is not a fracture, you can treat this at home by applying the R.I.C.E method and also early mobilization and some rehabilitation at home by doing some exercises. Now, this is what you want to do if you have an ankle sprain. Now, if you're watching this video and you have a sprain of your ankle before and you apply some of these methods work for you, why don't you share this with our viewers so they can also learn from it? Now, on the next video, next week, I'm going to give you a differences between a sprain and when you should go in and get an x-ray or get checked by a physician. So stay tuned, because remember that in the 21st century, you are your own physician. So until then, Dr. Moses, I'll see you on the next video.